Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is venous drainage of lower limb. Venous drainage of lower limb. Look, the veins of the limbs, upper and lower, it is being divided into two groups. Number one, deep veins, and two, superficial veins. The deep veins are those veins which accompany the arteries. They are usually the vena commitants of the arteries, and you know the arteries lie deep, covered by muscles. That's why deep veins of the lower limb are, look over here in this anterior compartment. Over here is the anterior tibial vein, the vena committant of anterior tibial artery. And then over here is the peroneal vein, the vena committant of peroneal artery. And posteriorly, over here deep is the posterior tibial vein, which is also the vena committant of posterior tibial artery. These veins then ultimately follow into the popliteal vein, and then popliteal vein ascends upward, and then it comes to form the femoral vein. And the femoral vein running in the adductor canal, it comes to lie over here in the femoral triangle. And then this femoral vein, then it passes into the pelvis, and it becomes the external iliac vein over here. You look, it becomes the femoral vein, it becomes the external iliac vein, and then the common iliac vein, and ultimately into inferior vena cava. The same, you look over here, look, this is the anterior tibial artery, and over here is the anterior tibial vein. And then you can see over here, this again, this is the anterior tibial artery, and then the posterior tibial artery and posterior tibial vein, and then it becomes, look over here, this is the popliteal vein, and then ultimately it passes, look, to this femoral vein, and the femoral vein becomes the external iliac vein. Okay, these deep veins which lies deep to the muscles, you know that these muscles, when compressed during walking or during running, these veins, they apply pressure over the blood veins and helps in pumping the blood from the distal to the proximal, or from the inferior to the superior part. The muscular activity plays special role in pumping of the blood from these deep veins superiorly. Okay, and then these deep veins have more waves, and these deep veins are more thickened than the superficial veins. The superficial veins consist of, look over here, make it close. The superficial veins are those veins which lies in the superficial fascia, that is, it lies between the skin and the deep fascia. And you can see these superficial veins, these blue veins, these are actually these superficial veins in the upper limb. In the same way, you can see these veins in the lower limb as well. They lie just deep to the skin and superficial to the deep fascia. And these superficial veins consist of, look, number one, the dorsal venous arch on the dorsum of the foot, and from it one big and long vein ascend upward. This is the long saphenous vein, and also on the posterior side there is one another small vein. Look over here, this is the small saphenous vein or short saphenous vein, while this one which you can see over here, this is the long or the great saphenous vein. In this way, the superficial veins consist of the dorsal venous arch, the long saphenous vein, and the short saphenous vein. And these lies in the superficial fascia, that is between the skin and the deep fascia. These veins, the superficial veins, have also veils, and these veils are more in the distal part of the veins, or in the lower part of the veins. The veils are more, and the important point is that the veils are unidirectional. Look, let me say, if this is the veil is like that. Look, the veil is like that. Then it allows the blood from below upward, but it stops the blood from coming back from the proximal to the distal, or from the superior to the inferior part. These are unidirectional veils, and this actually helps in prevention of blood from coming back from the upper part to the lower part. And then the most of the superficial veins then ultimately drains over here. Look this point, make it clear. This is the deep fascia. Lying upon the deep fascia is this great saphenous vein or superficial vein, while the deep vein you can't see because it is being hidden by the deep fascia. This femoral vein is the deep vein. The superficial vein lies over here. It pierces over here through the deep fascia, and this foramen through which it is called a saphenous opening, it passes through this saphenous opening and ultimately opens into this great saphenous vein. And over here, at the junction of the femoral and great saphenous vein, there is one veil which is called a saphenofemoral veil. Okay, and on its way, look, this great saphenous vein and the short saphenous vein, these veins are being connected by small veins to the deep veins. And these connecting veins that connect the superficial to the deep veins, these are being called as perforating veins. And these perforating veins are also having these perforating veins which connect the superficial to the deep veins. Let me say that is the deep vein. And look, this is the superficial vein, and this is the connecting vein between the two. This also have the veil which are also unidirectional. That is, it allows the blood from superficial to deep, but not back. But if these veils become incompetent, or the veils in the superficial veins become incompetent, then the blood comes back from the deep to superficial, and these superficial veins become abnormally dilated, which is being called as varicose veins. In this way, the superficial veins consist of dorsal venous arch, long saphenous vein, and short saphenous vein. And look, the venous drainage of the limbs and the lower limb, it is from inferior to superior side against the gravity. There must be some factors that it helps to drain the blood from the inferior to the superior part, and from the distal to the proximal part against the gravity. What are these factors? Number one, the muscular contraction. Look, you know the deep veins are lying deep to the muscles, And when the muscles contract, if the vein is lying over here, when the muscle contract and presses, the blood is being pushed superiorly. And number two, the negative interthoracic pressure, the pressure which increases when you take inspiration, the negative thoracic pressure increases, and this negative pressure then withdraw the blood from the peripheral toward the thorax or toward the heart. And then is the pulsation of the nearby artery. If this is vein, it is artery. When this artery pulsates, it also helps in pushing the blood from below to superiorly. And then this lower limb is being covered by thick fascia. This thick facial compartment also helps in venous return, and also the blood coming from the arteries to the tissue that also develop the accumulation of blood over here. It also develop a pressure which helps in venous return. In this way, these are factors that help in venous return from the lower limb superiorly toward the systemic and ultimately towards the heart. Now, in the next lectures, we will discuss the veins, that is the great saphenous vein, the long saphenous vein, and perforating veins, and what is the mechanism of formation of the varicose veins in detail. Thank you very much.